And this is where I want to talk to you a little bit about the kind of disease patterns are now changing in homeopathy and in world. The diseases are changing. And in last 3 decades, autoimmune disorders have started coming up in almost different systems. And what is autoimmune disorders? Because this is now so common in today's times. Autoimmune disorders, if you have to understand at depth, which I would like to share today. Autoimmune disorders basically are conditions where in which your own immune system mistakenly attacks your own body. The immune system normally guards your own body against bacteria, virus like this, But in this kind of autoimmune disorders, what happens is that they kind of feel that the senses, the senses for the foreign invaders are out. They feel that their own body cells are the enemy, and they start destroying their own body cells, thinking that they are the enemy. Imagine, imagine that the army of India at the Kashmir border and different borders of India are the immune cells or the immunity. Okay, and what happens in autoimmune disorders that the immunity gets affected, which means the army gets affected. So instead of fighting the enemy, they start fighting against their own country. So they start hitting people from their own country, and they don't understand. Oh, these are not the enemy. These are our own people. This is often the idea of autoimmune disorder. So they start mistakenly start affecting your body. For example, joints, for example, skin, for example, tissues. It kind of releases some auto antibodies that attack healthy cells. And autoimmune disorders are now so common. Type 1 diabetes affects the pancreas. Very common. Last few months, I've been treating many cases of systemic lupus erythematosus. So many common autoimmune disorders. Hashimoto's thyroiditis, SLE, rheumatoid arthritis, multiple sclerosis, which is more common in the US. Asthma, so common. Celiac disease, eczema, psoriasis, so many autoimmune disorders, more than 600 different autoimmune disorders. And there isn't much treatment in allopathic medicine except for giving immunosuppressants. And this is where homeopathic medicine and holistic medicines have tremendous results. And what is the approach that I apply, which I would like to share to you? Very often, what I have seen in autoimmune diseases is that very often before the autoimmune disorder really starts and the symptoms start, there is often a strong stress factor. There is a strong crisis factor. There's a strong emotional or a physical factor that affected the person a lot. And maybe after that, the patient start developing the symptom. Now, for me, when I take the history and the homeopathic case history, as you already know, my friends, is so different to the case taking in an allopathic background, because in an allopathic background, there is a symptom and there is a allopathic medicine. There is headache and there is allopathic painkiller for it. But in homeopathy, when autoimmune disorder comes or any disorder comes, we try to understand the person. And how do we understand? Is by we have developed many different pathways of understanding the person. So we try to understand the deeper pattern of the person through the deeper case taking, the chief complaint, the fears, the dreams, the stress factors, the past history, the family history, the childhood history. We try to go at a much deeper level and understand the person. One of the things that I often see in an autoimmune disorder is that I try to ask the patient that before your problem started, maybe 5 years, 10 years, 15 years before that, can you tell me what was the stress situation and how did you cope up in that stress situation? Now, in this case that I told you, which was of urticarial vasculitis, she told that just few years before she developed the symptom, there was a sudden death in the family and there was a lot of pressure in work. And what was her experience? The experience that she felt was a lot of responsibility on her and a feeling of shock. Her main experience was shock. How did it happen, man? How did it happen? So this experience was the main thing. So now, based on that and understanding her deeper patterns, her dreams, her stressful situation, her grief, etc., we prescribe the remedy Ignatia. And with the help of the remedy Ignatia, beautifully her health has improved in last 6 months. She's still under our treatment, but how beautifully she's improving. So this is the entire approach in autoimmune disorders. And I want to just clarify one thing before I go ahead. In homeopathy, I don't generally like to straight away stop the allopathic medicines. I like to gradually taper the allopathic medicines down. And sometimes I would give homeopathic medicine along with whatever medicine they are taking, and then gradually taper it down. This really helps the patient and their relatives because they kind of feel more comforted instead of a sudden reaction. Along with that, the other thing that I give a lot of importance to is I try to do what is called as a homeopsychotherapy, which means I try to understand the person. Like if it is a ignatia, then I will try to explain them what are the roadblocks in their life, how they are perceiving life, and what is the sensitivity for them. When you explain them their own state in their own way, there is a kind of awareness, and that helps in healing a lot. Definitely in today's time, you have to make certain diet changes, certain exercises, yoga, meditation. When you do all this together, there's a remarkable changes that we can help heal many cases, including autoimmune disorders. So this was a little bit of my idea to all of you so that you can help your patients in that way.